A stroke is a serious life-threatening medical condition that happens when the blood supply to part of the brain is cut off. Strokes are a medical emergency and urgent treatment is essential. The sooner a person receives treatment for a stroke, the less damage is likely to happen. If you suspect that you or someone else is having a stroke, phone 999 immediately and ask for an ambulance. Symptoms of a stroke. The main symptoms of stroke can be remembered with the word fast. The face may have dropped on one side. The person may not be able to smile. Arms. The person with suspected stroke may not be able to lift both arms and keep them there because of weakness or numbness in one arm. Speech. Their speech may be slurred or garbled, or the person may not be able to talk at all despite appearing to be awake. They may also have problems understanding what you're saying to them. It's time to dial 999 immediately if you see any of these signs or symptoms. Causes of a stroke. Like all organs, the brain needs the oxygen and nutrients provided by blood to function properly. If the supply of blood is restricted or stopped, brain cells begin to die. This can lead to brain injury, disability and possibly death. There are two main causes of strokes. Ischemic, where the blood supply is stopped because of a blood clot, accounting for 85% of all cases. Hemorrhagic, where a weakened blood vessel supplying the brain bursts. There's also a related condition called a transient ischemic ataxia, where the blood supply to the brain is temporarily interrupted. This causes what's known as a mini-stroke. It can last a few minutes or persist up to 24 hours. Get medical advice as soon as possible, even if your symptoms get better. Certain conditions increase the risk of having a stroke, including high blood pressure, hypertension, high cholesterol, irregular heartbeats, atrial fibrillation, diabetes. Treating a stroke. Treatment depends on the type of stroke you have, including which part of the brain was affected and what caused it. Strokes are usually treated with medicine. This includes medicines to prevent and dissolve blood clots, reduce blood pressure and reduce cholesterol levels. In some cases, procedures may be required to remove blood clots. Surgery may also be needed to treat brain swelling and reduce the risk of further bleeding, if this was the cause of your stroke. Recovering from a stroke. People who survive a stroke are often left with long-term problems caused by injury to their brain. Some people need a long period of rehabilitation before they can recover their former independence, while many never fully recover and need ongoing support after their stroke. Preventing a stroke. You can significantly reduce your risk of having a stroke if you eat well, take regular exercise, follow alcohol advice, not drinking more than 14 units a week, quit smoking.